This is about the common compensatory pattern innovated by Gordan Zinc, my professor where I did my fellowship at the Des Moines Osteopathic College. It's a platform for diagnosing what ails the patient and also for determining impaired diaphragmatic function, therefore the breathing mechanism, and what he called the respiratory circulatory model, as well as determining vitiated or impaired lymphatic and venous drainage. If we can influence respiration, we influence the drainage of the lymph and the venous fluid, we influence the nerves and the myofascial planes, we do have a model that can really impact the health of the patient. So let's take a quick look at that pattern of that axial skeleton as a platform. You can start with the medial malleoli and find, for example, an artificially short leg on the left and on the right a little longer. The pubic symphysis we can determine to be a little elevated on the left, which is typical. We do a little rotation to see where the L5-S1 junction is functional. It's tight moving it this way, meaning it's rotated that way to the right. We can check the thoracic cage. You can see it's deviated off to the left, which is the typical pattern, with the lower ribs being taut. We can go up here and see that there is definite right rotation and compensation to left side bending and rotation of the thoracic inlet, with the first rib carrying the other ribs down, and tight where the lymphatics drain here on the left, and that elevated rib here on her left. She's had a couple of car accidents. We can see that most likely the thoracolumbar is going to be tight on that left side. We can see that there. And then we can go and see that the occiput slipped off. You can see the chin slipped off to the left, so it's slipping here in compensation for the right rotation. But she's a bit out of pattern at the second cervical. She's rotating very well to the right, and she's tied up so that she's rotated right. She needs to be rotated to the left. That's a full pattern analysis. More later.